Hello everyone, this is Tara Kempson, one of the deputy editors from RadExam, and this short video is going to help you understand what RadExam can do for you as a program director. As many of you know, RadExam was created as a formative assessment tool for medical knowledge on different rotations that residents will go through during their training. And I think that this remains one of the most important roles of RadExam as you integrate it into your residency program. We have multiple versions of different examinations crossing multiple specialty areas. We typically have versions 1, 2, and 3 for most examinations for multiple levels from R1 through R4 and into the fellowship year. So we do have a number of exams that can help you to understand where potential gaps are for your trainee. You can look at their scores relative to their peers within their class and within the program. You can look at comparative data to national means, which does get collated after there's been enough administrations of a particular examination. So that's one very important role that RadExam can help you with when you are using it to assess resident performance. Along the same vein, RadExam can help you with curriculum revision or development. One of the things that program directors can do is try and trend their data to see if there are either examinations or topics that residents are struggling with, where they're seeing scores that are either below the average within that program for that year of the training, or that are below national averages for that examination. And that can really help you to determine if there are areas within your curriculum that are not providing the residents with enough information or enough support to understand that material. So I do encourage people to look at their trends at least annually and see if there are areas that could be buffed up, or if there are gap areas where the residents are really struggling, and then to try and engage the different faculty members of those sections to help to revise or develop curricula as appropriate. Individual resident progress, I think most of you are familiar with how RadExam can be used for this. So you will get individual resident progress information as they take their different examinations, and you can see how they have scored relative to other trainees within the same year at your institution or across different institutions using the national data. So this can be very helpful to identify areas where there may be gaps in the resident performance, or to see if they are struggling or doing exceptionally well within areas. Obviously, we always tend to look for things that people are doing wrong, but we also want to recognize that there are things that people are doing right, and to help reinforce where they're doing well and to continue to encourage them along those study parameters. Having said that, remediation is something that unfortunately as program directors you will need to deal with, and RadExam can be helpful in that part of your program performance. RadExam can be used to either give additional examination attempts to trainees who are struggling to see if whatever remediation plan you have put into place can help them to improve their performance. It can actually be used for remediation of professionalism, which I'll touch on in just a second in terms of how it can be used for professionalism. And it can also be used as a confidence boost, for residents who just need a little bit of extra support and want to see if the work that they're putting in to meet the remediation plan that you have developed with them is actually working for them. You can actually give them the exams again to see if it is really helping them, and that can help boost their confidence as they're working through their remediation, because they obviously want to succeed. I mentioned professionalism. RadExam actually has added a column to the CCC and PEC reports where you can see the number of completed examinations per resident. Your program coordinators can tell you how often they may need to reassign an examination to a particular trainee if it falls outside of the window for which they are assigned. And really, this can be viewed as professionalism metrics. Professionalism is sort of difficult to assess in programs, but this is one defined data point that you can use to help your CCC discuss professional behaviors of the trainees. If somebody is routinely not taking their examinations, particularly after you've reminded them, that can be viewed as a marker of a lapse in professional behavior and can be one data point that you can use in your CCC. Compliance with ACGME reporting is obviously straightforward. We provide CCC and PEC cumulative reports that can be exported and brought with you to your meetings for easy access to information. And I hope that that helps for that. Faculty development is another area where RadExam can be helpful. And you might wonder how that can be, but it is really around the concept of helping faculty to become better educators. And that involves both writing questions de novo and also editing questions, because that will help with their writing skills. So we at RadExam offer a number of times over the course of the years a workshop where people can learn how to write an exam question or how to edit an exam question. I believe we're going to be doing it at AUR 2025. But if you are interested in having your faculty develop skills around writing or editing questions, please reach out to any members of the RadExam executive committee, and we'll be happy to have a discussion with you about how we can provide support for training of these skills. Thank you.